So how do you assess the viability of the embryos before transfer?
It's a matter of grading.
Okay.
So we grade the embryos. We right now, in 39 and also in many other companies, we do extended culture. We go to blastocyst, which is the fifth or sixth day of embryo culture of the embryos in the laboratory, which is the maximum days of the embryos in the laboratory. So we have all the information of the embryos right from the beginning. We have information of the oocytes, of the sperm during the injection, the whole evolution and development of the embryos in the laboratory up to the blastocyst stage. And in the blastocyst stage, you can also assess the quality of the trophectoderm, the inner cell mass, all the information about the future baby, and we have these grading systems in place. So if an embryo is able to get that stage in which they are expanded, beautiful blastocyst, and we can have also information about the quality of the cells and the whole thing, it's very likely that we have information about the potential to get a pregnancy of those embryos. So it's a matter of development in the laboratory and grading systems.
So how is genetic testing done on embryos in IVF, sir?
It's about making biopsies. Okay. You need to have some cells of the embryo, in this case on a blastocyst. You get some cells from the trophectoderm to make this chromosomal analysis. And you send the samples somewhere else for the analysis, and they give you the information about each embryo, about the chromosomal status. And we may have euploid embryos, chromosomally normal embryos, and we have aneuploid embryos, chromosomally abnormal embryos. With this report from the genetic provider, we know which ones are the viable embryos and the good ones to transfer, and we may have then healthy pregnancies.
So one last question, sir. So what is PGT, sir? So many people are talking about it. So what is PGT?
PGT is basically about this pre-implantation genetic testing or screening, nowadays, PGS. So again, it's the same thing as I mentioned before. It's about making biopsies to embryos to have more information. It's not just the grading, it's how they look, about the shape. It's also about the chromosomes, to see if they are normal or abnormal. So it's probably the best way to know how viable they are and if they are going to end up in miscarriages. So we can avoid all these factors and we can reduce the time to pregnancy as much as possible.
So thank you, sir. Thank you for talking to us.
Thank you so much.
Do you want to share any of your thoughts to our audience, sir?
I don't know.
Regarding IVF or awareness about IVF in India?
I mean, one of the things I've learned from India is the importance of family. It is very important. Family is something very, very important in India. So once somebody wants to become parent and they can't, it's a real issue. And we need to be ready to help those couples as much as possible because it is very critical. Family is something very important in India. So one of the things I would like to raise also in society and for India is the importance of having all the information available as soon as possible. To have, if possible, some information about your reproductive health also from some doctors to see if there is any issue, so you can do something in time also. And in case that you have also, because of your lifestyle, you want to postpone this decision, which is pretty normal nowadays, to have all the information possible about what to do, how to do, the expectations, the prices, all the information there, because again, information is power. So that would be the main thing to do. If you need help for that, we can help you. But you need to have all the information first, and we need to make this more natural also.